Hello and welcome to the Evolved Mushrooms channel. My name is Jonathan Fredette, and we are here to help guide you through the world of natural medicine, medicinal fungi, mushroom cultivation, extraction, and all the different tangents that come from all of these different beautiful conversations. It's our goal to help enhance our community with tools and awareness that can help bolster their own lives, whether they're facing daily stressors, challenges. We want people who tune into our content to feel like they have more options as far as where to turn to when it comes to natural medicine, themselves, and their own healing. So I'm really excited for this upcoming podcast interview that I did with Dr. Anna Sitkoff. She is someone who I've been following for some time within the medicinal mushroom sphere because she has published a good deal of information, has posted extensively, and has helped guide us through some of the cutting edge and more nuanced understanding of medicinal fungi and how they can help benefit us on a daily basis. So Dr. Anna Sitkoff is a primary care naturopathic physician, a functional mushroom consultant, medicinal mushroom educator, and has an extensive background in herbalism and laboratory research at Bastyr University. She is the co-founder of Lucidum Medicinals and is currently published in the Journal of Immunology. She also wrote the Medicinal Mushrooms chapter in the 5th edition of the textbook of natural medicine and is currently on the North American Mycological Association, or NAMA for short, a committee that is here to explore the cutting edge of mycology. So I'm really excited. This entire interview we've done specifically looks at autoimmune conditions and medicinal fungi. But the conversation can benefit so many of us who don't necessarily have an autoimmune condition diagnosis. Because there's so many different talking points, we tried to cut the conversation short to about an hour, but I think we'll have many more to come. I was really excited for this one, and I hope that this benefits you in a broader, deeper understanding of medicinal fungi, and I hope you enjoy. Doctor, thank you so much for joining. I really, really appreciate it. How are you?
I'm good. Yeah, thanks for having me. It's pronounced Anna, just so you and everyone else knows.
Perfect.
Yeah.
Yeah, perfect. Yeah. Well, this is the first time meeting you, so it's a pleasure.
Yeah.
And this is an important topic. I think that this is a topic that is emerging within the sphere of discussing mushrooms, but also looking at best ways to help clients and community with understanding their own personal health and wellness. This is something that within my own practice has come up numerous times and is something that I'm excited to address, and I'm excited to learn more. So thanks for being here.
Yeah.
So should we start with just a basic introduction of what is autoimmunity and what is an autoimmune condition?
Sure. Yeah. So an autoimmune condition is basically when your immune system starts to attack your own body. And that can be in different ways. So it can be attacking specific organ tissues or different your immune system can attack your immune system.
Wow.
So just to divulge some personal information. So I have chronic autoimmune urticaria. And what that means is that my immune system is actually attacking my IgE antibodies, which is another aspect of my immune system. And so it can really be like any kind of what's called like autoreactivity. It's like sometimes autoimmune diseases mean that your immune system is attacking different cells in your colon with inflammatory bowel disease, or can attack thyroid tissue with Hashimoto's, or can attack your nervous system and make it so it's breaking down your myelin sheath with multiple sclerosis. Mm-hmm. It's like name a tissue and the immune system can attack it. And then there's like autoimmune diseases where the immune system is just attacking like DNA. And so there's different levels of severity, and you can have an autoimmune disease and have antibodies to different tissues in your body without necessarily having symptoms. So that's usually like the first stage. And then once the immune system starts to kind of attack more, then you start to have symptoms. And then you can also go through periods of, even though you have antibodies, you can be in remission and have periodic flares. So there's a lot of different kinds of autoimmune diseases, and the triggers for them differ. But also in my practice, I kind of treat them all the same. So I kind of like go through the same list of like the most common triggers and imbalances in the fundamentals to health, and correct for those things. And whether it's Hashimoto's or celiac or ulcerative colitis, like all of those things are important, and baseline treatment from a naturopathic perspective ends up being like very similar.
As far as helping potentially soothe the immune system and regulate it and get it to a place of greater balance as opposed to hyperreactivity?
Totally. The goal is improved immune tolerance is what we call it.
Understood. Got it.
Yeah.
Well, and it seems, based on a little bit of research that I've done, and just anecdotally hearing different cases emerge, it looks like there is an increased incidence rate that is increasing globally every year. Can you speak a little bit about what you may believe in your practice are some of the root causes of that? I mean, I imagine
it is multifaceted. Yes, it is increasing, and especially women experience and are diagnosed with autoimmune disease far more than men. I think that there's a huge environmental component. So especially like plastics is a big problem, and there's more and more in the environment and in our systems over the years. And I think that that's definitely playing a role in more autoreactivity and inflammatory disease generally. Really plays a huge role in increased cancer incidence as well. With that, with the plastics and with endocrine disruptors generally, there's more of an imbalance in estrogen. Too much estrogen can actually be inflammatory and can increase risk of autoimmunity, which is, I think, part of why there's more women with autoimmune disease. And so the more endocrine disruptors that you're exposed to, the more of these xenoestrogens, or like compounds that look similar to estrogens and work in the body like the more inflammatory estrogens are going to be. And so then there's more likelihood of poor immune tolerance. Gut microbiome dysregulation is a huge cause of decreased immune tolerance and higher susceptibility to autoimmune disease. And I think there's been so much more antibiotic use, and just, I think, poor diet. People don't eat a lot of fiber. They don't eat a lot of fermented foods. I think, yeah. So dysbiosis, or that unbalanced gut flora, is playing a really big role there. Just general environmental toxins exposure plays a huge role.
Are you following the glyphosate conversation at all, and how the herbicides are, leaching into our food supply and through grains and things of that nature?
Yeah, totally. And glyphosate is known to decrease, or I should say increase, intestinal permeability. And so what that means is that you're basically getting a leaky gut, which is really a root cause of a lot of autoimmune conditions. If the intestinal barrier is open, if those tight junctions aren't if they've lost integrity, then there will be more undigested food proteins that can enter into the bloodstream, more chance of different pathogens, more chance of like LPS containing bacteria that can all go into the bloodstream. And so anything that's going to increase intestinal permeability will increase your risk of autoimmune disease. And glyphosate, is a huge, destructive.
Sometimes I take a step back and I'm like, how did we get here? How did we get to this point?
Yeah, a lot of people who wanted to make money, I think.
Yeah. And just about
Yeah.
the industrialization of our agricultural industry and the monocropping and everything. And I'm sure that there were, good intention actors there too, just trying to bolster up the food supplies as well.
Feed
But
people. Yeah.
yeah,
Yeah.
yeah. But now I really appreciate the conversation around fungi because it's understanding the biodiversity that's needed in the agricultural industry, and that in going away from that, we had to use herbicides and things like that to combat nature, which came in through insects that were combating, these monocrops, and it's like it wasn't nature's fault.
Yeah.
We veered away. And I really appreciate that about understanding the ecology of fungi is that we have to return back to some of these original principles.
Yeah,
Yeah,
definitely.
yeah. And so for anyone listening, what is glyphosate? And and maybe furthermore, how does that lead to also the immune inflammation of the gut and as a response to when things happen in the gut that the immune system targets versus the digestion, the healthy digestion. If that makes sense.
Yeah, I'm definitely not an expert in pesticides. I mean, my understanding of glyphosate is it's a pesticide, right? That's sprayed on our food. And so anything though that is going to be like killing, its jobs to kill pests, microbes. When we take that in, it's going to probably destroy a lot of our good gut bacteria. The less good gut bacteria we have, the more opportunity there is for the bad gut bacteria to overgrow. That's going to be more inflammatory, less likely to, it's not going to be producing the same kind of beneficial postbiotics or short chain fatty acids, which are essential for maintaining a healthy gut barrier. So it's like anything that is decreasing microbial diversity in the gut is going to be playing a role in destruction of gut barrier integrity, which will then lead to poor immune tolerance. So opposite of that, it's like if you're not consuming glyphosates, you're consuming these like organic, high fiber vegetables, ideally very diverse array. That's going to be the best way, even better than just like taking probiotics, to increase gut microbiome diversity, increase short chain fatty acids, improve gut barrier integrity.
Yeah, I think that was my next follow-up question. In your practice, do you prescribe or do you suggest probiotics, or do you mostly focus on prebiotics and high fiber foods?
It depends.
Okay.
If somebody has taken a lot of antibiotics and they're to the point where they have C. diff, Clostridium difficile, which is a very inflammatory microbe in the gut that causes horrible diarrhea. People can die from C. diff infections. And that usually only comes when there's been a lot of antibiotics in the system. So in that situation, I use like high dose probiotics. If it's somebody who just has, like, they've taken antibiotics off and on throughout their life, or they had a like traveler's diarrhea or some kind of infection, they have dysbiosis, but it's not severe like that. The best way to improve gut microbiome diversity is really not with probiotics. For the most part, they kind of go right through you. If you're lucky, some of them stick around. There is some benefit of them being in the system even for a short period of time as they move through. But for the most part, you want to just be feeding the good microbes that you have. And the best way to do that is with a high fiber diet that is very diverse. Mushrooms are a perfect part of that, right? They're prebiotic polysaccharides in the cell wall. And those are the beta glucans and chitin for the most part. And they are amazing at feeding all of the good gut bacteria and decreasing species that are more pathogenic or going to cause an issue. And then I think that fermented foods also play a huge role, especially kefir seems to be kind of the most helpful for dysbiosis as far as fermented foods go.
So preventative measures, people could simply just cook some oyster mushrooms and eat some kefir and some sauerkraut and kimchi.
Totally.
Absolutely. Just start nurturing the gut. I mean, and that's a good dish too, honestly.
Yeah, that sounds great.
That's what I love about natural medicine is you can actually enjoy the process of it before you get sick, you know.
Yeah,
Yeah.
yeah. And then in addition, I think to the prebiotics and stuff, the like high polyphenolic compound rich foods like blueberries, can add some blueberry compote for dessert to that
Yeah.
dish, and
Yeah, absolutely.
some
There you go.
pomegranate. Yeah, be
Yeah.
perfect.
So, are there any favorite mushroom dishes that you make or that you recommend as far as the culinary side goes?
Um, I usually just tell people to chop them up, and I really like to saute in some butter. And
Hmm.
then I like where they're just about to be ready, but not quite soft enough, I put some tamari on top.
Okay.
And that is actually, and then they get super soft after
Yeah.
you do the tamari. And that is like, I've never met anyone yet who has not appreciated mushrooms in that way, even like people who don't really like mushrooms.
Hmm.
So I usually just keep it super simple like
Yeah,
that. Yeah.
absolutely.
What's
I
your
think
favorite way to cook mushrooms?
I use it to supplement in dishes. I'm definitely a big carnivore, so I'm eating, steak and shepherd's pie this week. And so what I'll do is I will throw in shiitake and oysters specifically just to know, that I have additional protein sources, additional fiber, and it's a good way to counteract some of the higher meat consumption that I have. And then I also challenge myself to just do mushrooms as like the entree as opposed to cooking like a steak. It's like, can I make a lion's mane steak and then make it
Uh-huh.
taste good? And I think my favorite example was my brothers and I were barbecuing hamburgers, and we did a side by side bison burger with lion's mane and cassava.
Hmm.
And the lion's mane cassava outperformed in every category, like taste,
Interesting.
texture.
Uh-huh.
And I didn't really think that it would. And I was like, okay.
Interesting. Yeah, I'm
Yeah.
such a carnivore myself. I'm like finding it hard to believe that a mushroom could outdo a steak, but I'm impressed. It must have been cooked very well.
Okay, it wasn't a steak, to
Oh
be fair.
yeah,
It was a
right. You said
hamburger.
bison burger. You said hamburger.
Yeah.
Yeah. Okay. Okay.
And I will stand with you in that. I don't think that a mushroom. I'm with
Yeah.
you there. Yeah, a New York strip, hard to beat. Really hard to
Yeah.
beat. Yeah, I mean and then a good friend of mine. I remember he asked if I had maitake before, and I said no, and he's like, okay, just sit back, and it was just butter and garlic, and he grilled it to a crisp, and I think that a lot of people which I get this a lot, and I imagine you get this a lot. People are just like, I don't like the taste of mushrooms. I don't
Yeah.
like and I'm like, which mushrooms have you had?
Right. They're like eating raw mushrooms in a
Portobello.
salad bar.
Yeah.
Yeah, portobello or like button mushrooms. Yeah. And yeah, I love maitake so much. I feel like my go-to cooking mushrooms is like maitake and shiitake
Hmm.
and oyster. I love oyster
Yes.
mushroom. And then I love enoki also. I think
Gnocchi's
enoki is
great.
like, yeah, you could just like have it like spaghetti.
It's like a little accoutrement in a soup too. It's like the
Yeah.
best like little garnish. And
Yeah.
I love that as like mushrooms as a garnish. Um, I think one thing to speak to are the ergothioneine components of oyster mushrooms. I think that is one of the most fascinating compounds to look at as far as enriching your diet, and I would love people to learn more about that.
Yes. And ergothioneine is really high in maitake and shiitake as well,
Okay.
and lion's mane. Yeah. But especially oysters and king oyster, golden oyster, even more so. So ergothioneine it's an amino acid. It looks pretty similar to glutathione, which is, if anyone doesn't know, is like our body's main antioxidant defense system. Ergothioneine is super bioavailable. So studies show that the amount of ergothioneine in the mushrooms that you're eating, basically 100% of that gets absorbed. We have specific transporters for ergothioneine in our body, even in the blood-brain barrier, and especially in cells and tissues that are more susceptible to oxidative stress. So another really cool thing about ergothioneine is that once it is taken up by the cell, it can be stored for up to a month and used for backup. So our body can become depleted of glutathione if there is significant exposure to any kind of oxidative stress. And so that can be, I mean, if you're exposed to a lot of chemicals, if you're exposed to toxins, smoke, anything like that. And so glutathione can become depleted. And the less antioxidants you have in the system, the more damage that can happen to DNA. And so it's wonderful to have ergothioneine as this backup system to glutathione, where it can work as like a main antioxidant defense system. There are studies showing that because I think that the ergothioneine, since it does cross the blood-brain barrier quite easily, it can help to prevent neurodegenerative disease. And ergothioneine, I mean, there's just like so many things that are so interesting about it. It also binds to heavy metals, and so it can be an important part of like a heavy metal detoxification. There's certain issues with fertility for men, where there can be kind of an imbalance in metals in the semen, and there is ergothioneine transporters in the seminal vesicles in men, and so it can also kind of help with any like oxidative stress there. So important for fertility. And then also there's not human research on this yet, but there's this really cool paper talking about the use of ergothioneine for prevention of preeclampsia. So preeclampsia is a condition that some women get in pregnancy, where you get really high blood pressure and you start to spill protein in your urine. It's very dangerous. The main preventative treatment for that is like low dose aspirin. But the root cause of preeclampsia is really like mitochondrial dysfunction. And so this paper is all about how ergothioneine, through its support of the mitochondria and healing of the mitochondria, can probably help to prevent preeclampsia. And it's so safe. It's safe during pregnancy. It's safe during breastfeeding, really like any time of life. Like ergothioneine is very safe. And so you can take it as a simple molecule, but you can also just like get it from eating mushrooms. It's so bioavailable.
So it's something you recommend pregnant mothers?
Totally. Yes.
Okay.
Yeah. And like I said, since it can be stored, it's like even if you're eating a lot of mushrooms, even before becoming pregnant, like that can benefit you and probably help to prevent preeclampsia during pregnancy.
Yeah, sure. Do you recommend just eating mushrooms for the highest yield of ergothioneine, or are there mushroom supplements that you recommend as well?
I mean, most people don't eat enough mushrooms on a daily basis to really like get enough ongoing, unless you really love mushrooms. I guess it's possible. I would recommend trying to get at least like 10 to 20 milligrams of ergothioneine. I don't totally remember the exact amounts of ergothioneine per gram of dried mushroom. I just I have a monthly newsletter, and I shared it on there, and I don't remember right now, but that information is available online. People can find that. But if you're not eating mushrooms every day, there are different ergothioneine supplements that you can take. If you take even just like a mushroom supplement that has like shiitake and oyster and maitake, chances are that you would probably be getting enough. But if I was really concerned about preeclampsia or some other kind of condition that is associated with mitochondrial damage, like if somebody had like really severe chronic fatigue syndrome or something, I would probably recommend doing like an ergothioneine supplement in addition to eating mushrooms.
Okay, to double down on the dose.
Yeah.
And then is there a mushroom that you recommend in the supplement for? Is that the same maitake, shiitake, and oyster?
So golden oyster. Golden oyster or king oyster would be the best.
The highest yielding. Okay. And then to furthermore, and just looking at that point too, I remember you were, I think, posting about a study and the discussion around lion's mane and nerve growth factor, looking at the hericenones and the arenacenes, but
Yeah.
I think we're like, actually, we need to start looking at the ergothioneine components, because that may be what's actually supporting that nerve growth factor and that protection of the brain.
Yep.
Yeah,
Yeah,
fascinating.
totally. I
Yeah,
know. Yeah. And then I mean, thinking about that, right? It's like you've got all the mycelium folks that are like only mycelium because that's
right,
what has the erinacines, and
right.
the fruiting body folks that are like erinacines don't matter, like hericenones are enough. And, this whole discussion in the mushroom world.
Hmm.
And it's like, well, it's like, first of all, it's like very reductionist.
Yes, it is.
It's like, let's not think about mushrooms in terms of like one individual constituent. There's a lot of
Right.
synergism happening.
Hmm.
And I think that, yeah, I think ergothioneine actually like plays a huge role in the nervous system supportive qualities of lion's mane.
That's beautiful.
Yeah.
Yeah, I love that. That's what I'm trying to focus on in my education, is looking at nervous system, because so many people are, have anxiety and things like that. So it's beautiful to look at, okay, well, we can come in with ergothioneine and help support some of those symptoms potentially. And also as a pathway of reducing inflammation as well through the antioxidant capabilities,
Yeah.
which is also, I imagine, I mean, inflammation is such a broad term, but as a trigger for downstream autoimmunity, right?
Yeah,
Right.
yeah, exactly. And that's how, I mean, one of the more direct roles that mushrooms can play in autoimmune disease is that many of them can actually increase like the transcription factors for T regulatory cells. So they can increase something called FOXP3, which then will increase your T regulatory cells, which play a huge role in overall immune tolerance. So yeah, the more anti-inflammatory cytokines or these like chemical messengers like IL-10, the less of an inflammatory response you'll have. And mushrooms are amazing in that many of them, they have this anti-inflammatory response where they can stimulate production of these anti-inflammatory cytokines, but then sometimes they are also pro-inflammatory, like they increase IL-12. And so it's really this dual action. And I think a lot of people are hyper focused on the immune stimulating effects of them. And the idea, I think, especially since COVID and everyone kind of heard the term like cytokine storm a lot, they're
Hmm.
just like, no cytokines. Like, I
Right,
don't
right, right,
want,
right,
we
right,
need cytokines for our body to work.
right, right, right,
And they're not all bad by any means. And we want this balance.
right.
And yeah, and so some mushrooms tend to be a little bit heavier on the pro-inflammatory, but this doesn't mean they're causing inflammation. It just means that they're kind of stimulating specific cytokines like IL-12, which then
Got it.
actually have like more of an antiviral and anti-cancer effect, and we want that.
Right.
We do. And then yeah, so
There's a whole picture here. I mean, that's
yeah,
the thing I love about natural medicine, is that and mushrooms in general, is just the holistic approach and how many different organ systems and pathways they touch on. And like one of the conversations in addition to the mycelium fruiting body debate, which continues ad nauseum, is the discussion around, which I know you can empathize with.
yeah, totally.
Yeah, yeah. I mean, how many times a week do you get that question, right? Like,
Yeah,
well, I guess it's part of the job, right, is educating.
yeah,
But,
yeah,
I think just looking at beta glucans, right? It's like, especially when you look at the mushroom industry, like first it was which mushroom product has the highest polysaccharides, and then that was a really, really poor evaluation of a good mushroom product. And then now it's like, well, what is the highest concentration, highest saturated extract product? What has the highest beta glucan count? And it's I mean, and I'm appreciative of like my herbalism background, because it's not reductionist. It's like, it's
yeah,
not about that. And I'm constantly trying to educate people who want like the most potent extract for their clients, so they can market this 20 to 100,000 milligrams in one dropper. And it's like, no, it's not about that. It's about capturing the full spectrum as best as possible, right? And so do you think that there's an overemphasis on looking at beta glucans at the moment?
Beta glucans are definitely a huge part of what makes mushrooms medicinal.
Okay.
They're a huge part of that. So I think that yes, they should be emphasized. Like they have a lot of different actions, and they are amazing immunomodulators in themselves. And I think that, I mean, what's interesting is that with those like more concentrated extracts, you're not necessarily going to get more beta glucans. Like it's not always better for it to be more concentrated. I think it is always dangerous to reduce an organism to a single constituent, as we've discussed, and to only focus on beta glucans and triterpenes, which is usually that's like all people talk about, and now ergothioneine. And I think there's, some people are kind of focused on ergosterol, but yeah, for the most part, it's like beta glucans, triterpenes. It's hard because that's also like what the research is on.
Right. And that's how science
And
operates.
so that's what we know.
through-
That's how exactly. It's like we look at one constituent to better understand how the organism works, how it's benefiting our physiology.
Right.
But when we do that, it does become like people are only focused on that. And I think the question is like, what are you losing and missing out on by only focusing on that constituent? It's like by optimizing for more and more beta glucan, what is being destroyed?
Right.
And it's like if you're heating down and like subjecting the extract to more and more heat, like maybe, I mean, with lion's mane, there's diterpenes in there that are probably going to end up being destroyed. Like you might end up with less hericenones. Hericenones are important. You're going to end up, if it is like a mycelium product, you're going to end up with less ericinines the more heated the mixture is. So yeah, what are you missing out on is my question.
Right. It's an
Yeah.
ongoing science. And what I appreciate is the passion of different people in the mycology industry to create like the best products and things like that. And I know that there's like a marketing stint there, but it's also about care. And really that's at the end of the day, it's what are the testimonials of your clients, and are you seeing the transformative effects of that? And I wanted to ask you about that to the extent that you can share. Do you have any positive testimonial stories from clients that you work with autoimmune conditions that could maybe offer hope to people who are listening who don't really have a starting point, or maybe they don't have as many beautiful resources or naturopaths in their area? We exist in a country in the United States where that's not quite as extensive as it needs to be.
Yeah. So mushrooms are they're almost always part of a treatment plan to some degree, and I wouldn't necessarily I wouldn't say that they are like the main players all the time.
Okay.
And especially with my autoimmune patients, there's just like there's so many things that we are often exploring, and a lot of the time, I think what ends up like making some of the biggest difference is like eating enough protein and figuring out like a good sleep schedule, and like regulating circadian rhythms and blood sugar regulation, and dealing with past trauma. I often refer for like EMDR therapy, or this is where I think like psychedelic therapy actually like can play a huge role in autoimmune disease. There is this whole field of study called psychoneuroimmunology, and that's how trauma, it could be epigenetic trauma, it could be adverse childhood events, how all of that impacts the nervous system and so the immune system. And I have yet to meet anybody who has an autoimmune condition that hasn't experienced some kind of trauma in their life, or has had some kind of significant epigenetic trauma, either their mother, their grandmother, or something like that. So I take all of these things into consideration with all of my patients, and especially my autoimmune patients. And I think that, the ways that people express that they've benefited from mushrooms in that realm might be with sleep. I mean, some people, especially with reishi. It's so supportive for the nervous system and can really help to regulate circadian cycles and can help to improve energy in the morning and help with sleep at night. And I do think that it does some like deep nervous system work.
Yes.
And I've had a lot of patients benefit from that on a deep level. And I think part of that too could be that reishi specifically does increase these T regulatory cells and has an amazing immune modulating quality for autoimmune disease. So
Yeah, amazing. Yeah. Okay, there's a bit to unpack there. Then let's go with something basic maybe, because for people who don't understand, when we're saying immunomodulation, this is a word that is described very often when talking about the medicinal qualities of mushrooms. What is immunomodulation, and how do mushrooms influence immunomodulation, and how does that support the human system?
So modulation means that it's not necessarily stimulating and not necessarily suppressing. Mushrooms do both, and they seem to kind of have this effect where they do kind of what the body needs. So a good example of this is cordyceps. So you think of cordyceps as, cordyceps increases IL-12. It's a great antiviral. IL-12 is an immune stimulating cytokine. You would think maybe like don't use cordyceps with immunosuppressive drugs. It'll make it so the immunosuppressive drugs don't work. The main situation where you would be using an immunosuppressive drug would be with an organ transplant.
Right.
So there's research showing on humans that people who have received kidney transplants who are on immunosuppressive medication, when given cordyceps, the cordyceps actually increases the effectiveness of that immunosuppressive therapy and it improves kidney function. Yeah. So not contraindicated.
Right. The opposite.
The opposite. Yeah. Yeah, exactly.
And similar things are found with turkey tail in tandem with radiation therapy with cancer patients as well.
Yeah, so the turkey tail discussion is kind of an interesting one, where it's actually, so the main components of the turkey tail fungus that are used in research are PSK and PSP. So these are polysaccharide peptides that are actually patented from a certain strain of the Trametes versicolor mycelium. And that there's a drug called Crestin that was made from the PSK. So it's pretty detached from like the turkey tail mushroom that you find in the forest. There's not actually very much research on the mushroom itself and cancer patients.
Interesting. Okay. Yeah. Interesting.
There is, however, there's research using the turkey tail mushroom with Salvia miltiorhiza, the red sage root. So that combo, there's a few clinical trials on that combo showing that it does have immune stimulating properties. So it helps to increase natural killer cells in patients. And natural killer cells, for those who don't know, are our main defenses against like viruses and cancer. And then there is another human trial, I think, with turkey tail, fruiting body, and reishi, that combo for HPV.
Yes, got it.
Yeah.
Yeah, I do remember that one.
Yeah.
Jumping back to the cutting edge. Yeah, we're just going to jump around a little bit here. Now, there's so much to talk about, which is great. I love it. I always love it. So thank you. Neuropsychoimmunology. Did I get that?
Psychoneuroimmunology.
Got it. Okay. Psychoneuroimmunology, and understanding how psilocybin may play a role in the downstream effect of boosting our immune system, or even for that matter, other plant medicines, potentially ayahuasca. And we hear accounts of people who go down and are healed with these ceremonies, maybe down in Peru. And, there's not necessarily like clinical trials on those or anything, or like there's no, one molecule that's like, this is what shifted the immune system. So potentially it's that looking at that relationship and that pathway to the epigenetic stressors on the body and how they influence the immune system. Is that about right?
Yeah. Wouldn't that be cool if there was a clinical trial on like psilocybe and people with autoimmune disease to see how it changes things?
I mean, please, how
Yeah.
do we get that
Well,
funded?
and I'm curious, so there must be research on this. I'm just not familiar. So there's something called limbic retraining. Have you heard of this?
No.
It's like different kinds of like brain techniques. You're basically like retraining your limbic system so that your response to certain things in your environment or how you respond is different. So like
Got it.
people who have like really intense like chemical sensitivity, sometimes they do this like limbic retraining and then the chemical sensitivity goes away because it's really not that they're actually like sensitive to the chemicals, it's that their nervous system has just like developed this response of fear around the chemical
XYZ.
situation. And so it's kind of like rewiring the brain to not have these like negative associations
Right.
with things. And I feel like psychedelics would work in a very similar way. And I think especially like people who have autoimmune diseases, there are like a lot of triggers that I think could likely be unwound with limbic retraining or psychedelics.
Sure. And then you could also look at the reduced cortisol rate because of that, the less, and, which is the marker for stress, and how that can be an upstream benefit to prevent autoimmune conditions as well. Yeah. There's so much. There's so much here.
Much.
Yeah. Do you feel hopeful about the research being done right now and where the science is going with not only the mycology industry, but with natural medicine and naturopathy, or where do you stand on that in your perspective right now?
I think that there could definitely be more research. I'm not sure where the funding would come from. It's like research on therapies that can't be patented is
Right.
really hard to fund. Yeah. And I don't know what's happening with the NIH or like, it's just, I'm not, I do think that maybe like one benefit of the MAHA movement is that maybe people will be more interested in natural medicine. And so perhaps more money will go into natural medicine research.
Yeah.
I don't know.
Hopefully.
I don't know. Hopefully.
Yeah. It's
Yeah.
needed. It's so needed. It's life-changing.
It
And
is.
I wasn't
Yeah.
trying to draw you into a political discourse. Don't worry.
Oh,
There's enough
no.
of that
I
going
know.
on right now. Let's just
I know. It's
focus
like
on back to beta glucans. Let's go,
Yeah. Yeah.
yeah. Are there any specific autoimmune conditions? I have one in mind, but
Yeah.
to look at specific mushrooms for treating specific conditions, or not treating, but to help supplement and support.
Yeah, there are a few that come to mind. So lion's mane for MS, increase in nerve growth factor synthase can also help to increase myelin sheath formation, which is something that is destroyed and lost in MS. So I think that I would love to see a lion's mane and MS study. That would be fantastic.
It hasn't been done yet?
No.
Oh my goodness.
I to answer your other question,
Yeah.
just like in a small way, would be like there absolutely needs to be way more human clinical trials with mushrooms.
Yes.
It's like I'm like
Yes.
reloading my PubMed constantly. Like I look every single day, and like was any clinical trials like in the last
Right.
year?
Right.
And sometimes there are, and often in the last year there haven't been many. In the last 5 years, there really haven't been many. So I hope for more there.
And potentially that's also because of how recent fungi and mushrooms have become, appreciated by our scientific community, our general community. Like and they're really resurfacing again, which thank God, and I think that may be the reason. But I think we would have so much better of an idea of how we can better use them as tools if we
Yeah.
absolutely conducted more clinical trials.
I think so too. Yeah.
Yeah, yeah,
But yeah,
absolutely.
just to jump back to the specific autoimmune diseases. So lion's mane for MS, lion's mane for atrophic gastritis. So this is an autoimmune disease where your immune system is attacking your parietal cells, which are cells in your stomach. And then that causes a lot of inflammation in the stomach and often nutrient malabsorption. And there's an actual clinical trial on humans with lion's mane in patients with atrophic gastritis, and it really decreased inflammation and helped to heal that quite well. And then lion's mane with ulcerative colitis as well. So this is like, I think this discussion is happening a little bit more now, but
Yeah.
lion's mane for gut health like
Yeah.
needs to be emphasized.
Right. Well, it
Yeah.
was a tradition. I mean, if you look at traditional Chinese medicine, that's what they used it for,
Yeah.
was for the stomach. And, we have all of the marketing and everything around the brain health, which is fantastic. But it is a remarkable medicine for the stomach. Just like,
Yeah.
quick anecdote. I had a really bad meal in Seattle once, and it just didn't sit well, and I could feel my gut inflamed. And I took about probably 4 milliliters of lion's mane and chaga, and I was amazed that my symptoms subsided instantly.
Yeah.
Like that's a superpower to be able to have that. And
Yeah.
I think
Yeah.
that's why there needs to be more education about this. It's like these are very, very helpful tools. As a growing up, it was stomach conditions, for the longest time, and we didn't really have any treatment plan. Doctors didn't really know what was happening, and there were symptoms that were in my mind. I was anxious and depressed, and I had chronic IBS as a kid. And I look back at my diet and I'm like, of course I did. Like, yeah, looking back at what I ate. And it wasn't until we jumped into naturopathic medicine and I started doing acupuncture and looking at my diet that I actually began my own healing process. And that was all the way until high school, and I had probably a period of from 5th grade to high school of a tremendous amount of like needless suffering, and just following the standard American diet. Like, I'm sure there are a lot of stories like this out there of people who, like myself, didn't feel like they had a lot of hope. They, went to a Western doctor and they're like, we don't, we'll give you immunosuppressants or what have you. But truly looking at your lifestyle factors can transform your life, and that's what I love about natural medicine is incorporating these into your daily life, and you'll find transformation. It's beautiful that this opportunity exists.
Yeah.
Yeah.
Yeah. Definitely. That's why I'm a naturopath.
Right.
Yeah. I love seeing that every day with my patients.
Yeah.
Yeah.
And then just like a bit more about my story too, like in tandem with that, my mom was diagnosed with an unknown autoimmune disorder, right? Because I think they thought it was like sarcoidosis. And at one point, she was bedridden for several years. And I remember this as a kid, and it was painful because she was, unavailable for some time.
Yeah.
And she sought care for me through a naturopath. And in the process, the doctor was like, well, what about you? And she's like, what do you mean? He's like, well, you need help too, right? And then through that beautiful process of acupuncture and nutritional intervention and looking at our diet, and we eventually landed in more of like a pseudo paleo kind of approach, she was able to then get treated for years before she was even diagnosed, and had a great transformation in her own personal well-being and life. And yeah, it's just a little bit of a podium statement saying like we're going back to the lifestyle factors, we're going back to the natural interventions, and returning back to working with nature to heal ourselves, because that's where the original intelligence is, right? Yeah.
Yeah. Yeah. Definitely. Thanks for sharing all that.
Yeah, of course.
Yeah.
Yeah, it's my story. I'm passionate about it because I was sick for so long, and this is why I'm focused on mushrooms. Is so when people also have similar stories, I can help nudge them in the right direction, and hopefully help get them care too, which so many of us need.
Yeah.
Yeah,
Yeah.
yeah.
What was the specific autoimmune disease that you were curious about, that you were thinking of with the mushrooms? helping?
Hashimoto's.
Hashimoto's.
Yeah.
Yeah. So I think about reishi really, mostly just because reishi seems to be the most powerful at increasing T regulatory cells. And, it's not like thyroid specific, but Hashimoto's isn't necessarily a thyroid problem. It's an immune system problem.
Right.
And so, yeah, reishi can be really helpful there for just dampening the immune response.
I'm glad that my intuition served me well because I've got my mom on lots of reishi.
Perfect.
Yeah,
Yeah.
she's like, reishi's your one. Go, just keep it close.
Yeah.
Yeah.
Yeah, definitely.
Yeah, and then I guess they're not really effective mushroom powders out there for reishi. There's mushroom extract powders,
Yeah.
and maybe we should talk a tiny bit about why an extract is important for something like reishi. Yeah.
Yeah. Well, have you ever tried biting into a reishi mushroom before?
No, I will not.
Does not seem like it's going to digest very easily. Yeah, so when you heat any mushroom, but we're just using reishi as an example here, when it is heated, you are going to get more of the bioactive compounds are going to be more available for the body. So with reishi, I mean, we've talked about moving away from the reductionist view.
Right.
And in terms of autoimmune disease and like what we're looking for is that we do want more lanthanum triterpene glycosides. The ganideric acids are great immune modulators, and we want a lot of those polysaccharides. And to get those, we need to heat the mushroom, ideally in both water and alcohol. The alcohol is going to extract the ganideric acids a lot better than the water will. Because it's a triterpene glycoside, that glycoside component is slightly water soluble, but you're really not going to end up with a ton in a water extract.
Got it.
So yeah, it's important to have, if you're getting a powdered reishi extract, ideally it's either a 1-to-1, so it'll have those triterpenes present within the like fibrous matter that hasn't been sifted out, or it can be, an 8-to-1 that is both alcohol and water extracted,
Which
ideally.
is the dual extract.
Dual extract.
The dual extract, which is kind of, I would say that's becoming more of the norm as far as quality goes.
Yeah, and I think that it's not necessarily, it's not all mushrooms need that.
Yeah,
Might
sure.
be a controversial
Yeah,
view, but
let's
it's
go.
like tremella
Okay.
is like mostly polysaccharide
Right.
protein. Like there's not a lot of alcohol soluble components that you are trying to get from tremella.
Sure.
So just a water extract of tremella, you're going to get basically everything you want from it.
Well, and it isn't, and correct me if I'm wrong, but doesn't tremella have like these mucilaginous demulcent properties, and that's probably where that mushroom shines in its benefit, is that it's going to be
Definitely.
like a soothing, water nourishing, and I haven't.
Sjogren's. That's
What was that?
Tremella for Sjogren's disease. Sjogren's is an autoimmune disease that kind of attacks your mucous membrane. And
Oh, got it.
that
Okay,
protection.
perfect.
And, yeah. Anyway, so
But
any listeners out there,
if
it's
you
very
have
soothing.
if you have or some inflammation like along any form of the passageway from the mouth all the way down, something like tremella tea, right, would be helpful for soothing. And so potentially if you have
Totally.
also stomach aches, things like that, IBS, right?
Yep. Yep. And it's all those polysaccharides in tremella that create that. That's what's mucilaginous and
Right.
cooling and soothing in it. Yeah.
So like a good tea would be like licorice and tremella. Yeah.
Yeah. That'd be
There we
great.
go. Yeah. I feel like
Maybe a little marshmallow.
And
Slippery
some-
elm. Yeah.
some marshmallow. I
Yeah.
love marshmallow. Slippery elm I have not been able to get right because it turns into pure jello.
Yeah.
You have to use it very
Yeah.
sparingly as far as the dose goes.
Yeah.
I had a thought, and I'm not sure. I wanted your take on this. I feel like reishi is the mushroom equivalent of licorice in the sense that it's a great harmonizer in a blend. And so I've used reishi in an immune blend, a sleep formula,
Hmm.
a nervous system regulating formula because it shines on all. I mean, liver support. Like it just touches on so many things, kind of like licorice.
Hmm.
Yeah.
Yeah, I think that that's true. Yeah. I also it like the it blends so well with licorice and jujube date, which is like
Mm.
another kind of formula harmonizer in Chinese medicine. That trio for nervous system support is like it's amazing. Just like
Oh,
doing a decoction of jujube and licorice and
yeah,
reishi.
jujube. Okay, I don't know
Yeah.
about this one. The
Yeah.
the the herb that has really stood out is Scutellaria lateriflora skullcap.
Huh.
Can we
Yeah.
do a little? Can we do a
It's funny.
quick
I
little
thought you were going to
explanation?
say bicalensis.
No, that's
Yeah.
yeah. Okay.
Do you know the Chinese skullcap?
Okay. Actually,
Scutellaria bicalensis.
funny enough, I just took it for the first time this
Hmm.
last week. Walked into a naturopathic clinic. Okay, embarrassingly enough, with a hangover, and I was like, "Can I have some help?" And he's like,
Uh-huh.
"Here's some Chinese skullcap," and he mixed in a couple other formulas.
Yeah.
That started the detox process pretty quick.
Yeah.
That plus
I
the
love that
sauna.
herb.
Yeah,
Yeah.
so I would love to learn more about that. So is that the root?
Hmm.
Is that right? Versus
Yeah.
skullcap, it's the aerial parts,
Yeah,
the
but
leaves
it's a
and the leaves.
different species of skullcap too,
I
but of
see.
Scutellaria. Yeah, but it is the root that's used. Yeah, and it has more immune modulating, liver supportive qualities and less of the like nervous system
I see.
kind of impact of Scutellaria laterifolia,
Lateriflora, yeah, yeah.
lateriflora. Yeah.
One one of those Latin names,
Yeah.
yeah. I love, yeah, I've seen skullcap help people with Bell's palsy and
Hmm.
returning as a neuro restorative, tropho restorative, and helping, And then one of the things that is potentially interesting too is I've learned that skullcap has a little bit of niacin in it as well. So used as a potential supplement in tandem with psilocybin to make it more effective is just
Interesting.
like a query that I have, and I'm
Hmm.
kind of just a little bit obsessed with skullcap right now, and because it's,
Yeah, that's great.
yeah, an herb that has helped me so much over the past 2 years.
Uh-huh.
Yeah. Are there any herbs that you also, I mean, man, this is probably a big question, maybe a little too big.
Uh-huh.
Any other herbs that you also recommend people use that are similar to mushrooms, like that they can use on a daily basis if they have autoimmune conditions?
Hmm. Yeah, so ashwagandha is another one that can be helpful for Hashimoto's
Mm.
specifically, and then yeah, licorice is a wonderful immune modulator, anti-inflammatory as well. Kind of, I'd say like emphasis on anti-inflammatory in the immune modulation role of licorice that can be really helpful. The Baikal skull cap yeah, the Chinese skull cap is one. It really depends on the specific condition and the
Yeah,
person.
sure.
So it's a little bit hard to answer.
Right. It's a big question.
I think there's also certain things like to think about I think herbs can be really helpful for kind of like getting the mushrooms to where you want them to go. So it's like, especially, so if thinking about like deep nervous system support, using kudzu along with lion's mane and actually Baikal skullcap in there for more like Lyme disease, weird nervous system symptoms that come with Lyme disease, like that combination can be really helpful for like the kind of pins and needles kind of sensations
Mm.
with Lyme, which is not an autoimmune condition, although I think that's arguable.
Right.
I think that chronic Lyme is actually an autoimmune process
Mm.
that it's like, yeah, but
Yeah, good answer. There's so much,
yeah,
with herbal medicine, there's so much. And too, with mushrooms too, what we know about 5% of the biodiversity of fungi. So there's
there's so
a
much.
huge world out there.
Yeah, yeah.
I
But
mean,
adding like lymphatics to mushroom blends, I think can
yeah,
be super helpful.
okay. Cleavers.
Yeah. Cleavers, calendula, ocotillo.
Okay.
Yeah, red root can be helpful, especially if you're like wanting it to, if you're feeling weird after a meal, and maybe a little red root with the lion's mane and chaga.
Oh yeah, well,
Helpful for just kind of like moving the central lymph.
the digestive bitter, so to speak. Um, what is your perspective on chaga and when do you come in with chaga? I mean, chaga is it's almost its own category.
Yeah.
And I feel like it's very unknown. There's so much about it. There's the sustainability practices, but there's also the fact that it's not exactly a mushroom. It's a fruiting body of the birch tree. Yeah.
Yeah, chaga is so fascinating. Right, it's not a mushroom. Chaga, as we know it, like the wild chaga, is like 15% fungal mycelial mass, plus the rest of it is birch tree. It's like decaying birch tree matter. And so much of the medicinal benefit of chaga, the wild chaga, is really, I think, like the compounds from the birch tree. And any wild mushroom is going to have the components of the tree that it's growing on, and I think some of that should always be considered in the medicinal benefits. Even, I mean, cultivated mushrooms are going to be taking up compounds from the substrate that they're growing on. There's some interesting research with like mushrooms being grown on soy, and they have an increased amount of isoflavones.
Interesting.
Which is very interesting.
Which is in the master's mix of like all cultivators, right?
Yeah, and so we want isoflavones. Like, that's awesome. I want my mushrooms to have isoflavones in them. So anyway, that's like a whole other interesting topic. But yeah, I think chaga is a very interesting organism that
Indeed. Yeah.
is, I think it can be so helpful for gut inflammation.
Yeah.
And conditions associated, like skin conditions specifically is really what I think of. But the way that it helps with the skin conditions is through helping to heal the gut. So I see this with eczema and psoriasis the most.
Oh, fascinating. Okay.
Yeah, and chaga has like the highest ORAC
Yeah.
value of like anything. It's like
We know.
off the charts antioxidant.
Right.
And so, yeah, I think like that's amazing. Chaga also is super high in oxalic acid. And I have my own experience of like I've gone through different phases with a lot of mushrooms where I've like done mushroom fasts and I'm like only drinking mushroom tea and just like deep in mushroom world and when I was younger. But with chaga, I used to get like sores in my mouth with chaga tea because of the oxalic acid.
Interesting.
Yeah, and I think for somebody who, is sensitive to like kidney stones,
Yeah.
either put milk in your chaga tea because the calcium in the milk will bind to those oxalates and then you'll just poop them out. It won't end up in your kidneys, so that's a trick there. Any oxalate-rich food, if you consume it with calcium, you're actually less likely to deal with calcium oxalate crystals in your kidneys because it'll bind in the gut. So yeah, but generally I think
That's fascinating.
yeah, chaga can be a little
Yeah.
intense for me personally, for my mucosa.
Yeah, and I'm wondering if that's from, but what if you did an extract from that and you had a fine filter as well? I wonder if that would have like a tincture, for instance, would that have the same effect as a tea? Maybe because it removes some of the oxalates.
Maybe. I'd be curious to see like
Yeah.
the chemical components of obviously you wouldn't be like drinking as much of it.
Right.
And so there would be less there. Yeah, I don't think people like taking a chaga tincture every once in a while are going to end up with kidney stones. I think it's
Right.
definitely more of like drinking a lot of tea
Right.
kind of issue.
Right. I think there was that one case of someone who had a kidney condition and then had oxalates built up because they had a daily ritual of taking chaga tea every day for like years or something. And
Yeah, that could
yeah.
be problematic if you
Right.
don't have enough calcium in your diet, especially.
Right.
Yeah.
I think chaga is one of those mushrooms that needs to be explored more for clinical trials. per
There's
se?
hardly any. There's really only like one or two. Yeah.
Yeah,
And yeah.
there's a lot there. One question I wanted to ask: there's so many products out there, as you are probably acutely aware, that are just like your mushrooms, and it's like a bag of mushroom extract, and people are like, I take my mushrooms every day, you know. And I was thinking about that because we don't do the same with herbs. Like, oh yeah, I take my herbs every day, and it's like, what herbs are you taking, you know?
Yeah.
So I
Yes.
wanted to pick your brain about that a little bit because people are like, yeah, I take my mushrooms. I'm like, cool. Well, how are you taking them? What dose? What mushrooms? You know, and maybe
Yeah.
just touching on like that kind of approach. Is that okay for like the general person? Like you're probably going to have benefits from that, or is that actually more of like an expression of, you know, the myco industry and people just putting out mushroom products and it's like, here's your
Yeah.
mushrooms, right?
I mean, that's a product of like complete mushroom ignorance, right? It's
Uh,
like we're not seeing them as their own like individual, like every genus and species of mushroom has its own actions, its own energetics. It's all like they all work differently. And yes, like they do all have this like polysaccharide cell wall, and they are all generally going to impact the immune system in some way. And I think that people just like group them into this like, oh, they're good for the immune system. Let's just put them all in there. It's like, yeah, but so then you have this like 7 mushroom blend with like
right.
250 milligrams of all these different mushrooms. And like, are you getting the benefits of any individual one? Because you're
Right.
not reaching a therapeutic dose of any of
Mm,
them.
I see.
Yeah. So I think that there is definitely mushroom synergy. I think that they do tend to work better together.
Hmm.
But there's a limit to that, and I think I would put that limit at maybe like 5.
Okay.
Unless you're like drinking a lot of like if you're like throwing a bunch of mushrooms into a crock pot and then just like drinking that tea throughout the day,
Right.
like you're getting a pretty big dose. And
Uh-huh.
but if you have a tincture and you're having like a few dropperfuls,
Yeah.
like how many milligrams of each mushroom are you even
Right.
getting? It's like if you're like, oh well, reishi's in there, and I'm trying to really, improve my cortisol levels, or like improve my if you have like PCOS or something, you're like, oh well, my taki's in there, and I'm trying to like help ovulation. It's like, yeah, so it's like one component. There's no way you're getting 2 grams of my taki every day.
Totally. So
Yeah.
what should be, so that's a great question then. What is a good threshold dose to aim for? Okay, I'm going to try to generalize it, which is probably a bad idea, but whatever. What would be a general threshold dose to aim for to get the therapeutic benefit of a single mushroom?
So most mushrooms would be like 1 to 3 grams a day.
Okay. And
Yeah.
so if you're doing an extract, then you have to do a little bit of math backwards as far as like the milligrams, and so
Yeah.
we're talking pretty high doses there.
Totally. Yeah. So
Yeah.
if it's like a 1 to 3, so if there's like 1 gram per 3 ml, which
Hmm.
is like, I don't know, what are your extracts?
1 to 10.
Okay.
But that's just because you can't, I mean, like,
It's hard to get a lot.
I mean, if you're doing tincture and you're doing anything more than a one to
Yeah.
ten, it is sludge, and it's just not a good expression of it.
Totally. Yeah.
Sorry, you know. So maybe it's about it, you know, suggesting to my clients who do my tinctures higher dosing, but focusing on one mushroom, like kind of at a time.
I would do that. Yeah. One
Okay.
mushroom at a time if it's that kind of ratio. Yeah.
Right. Okay.
Um, yeah. I also, well, this is kind of another different topic,
It's
but
okay.
maybe
Let's
along the
tangent.
same
Let's go for
lines.
it. Let's go for it.
Yeah, like
We're
I
at
could
that
just
point.
talk to you forever.
I know, right? That's what you. Thank you so much.
Yeah, so like the idea of immune training. So
Yeah.
you can take mushrooms for a period of time and they have an impact on the immune system. And once you stop taking them or even like decrease the dose, then those immune benefits continue for months after you've stopped taking them. Or you can take less if you feel unsure about
Right.
the realness of immune training. But it is real. And yeah, and so just thinking about, these different mixtures, it's like maybe you like spend a little bit more money and take more mushrooms for a
Hmm.
period of time,
Right.
more like individual mushrooms. And this is really only with like if you're looking for the immune system benefits,
Right.
not necessarily like, yeah, the other million benefits that mushrooms have.
Sure.
But you could take higher dose for that month, and then if you wanted to just take whatever kitchen sink mixture, just so you feel like you're like getting some mushrooms on a daily basis, like that would be fine, because you would
Okay.
still have the immune training from that initial higher dose.
Right. Okay. That's perfect. Thank you so much. That helps me with informing some of my clients as well. So if I have I have a 1 to 10 extract. We do ultrasonic as well, which is real fun, using the sound, which is like penetrates the cell wall with high. It's such a nerdy fun thing. It's that alchemy, you know. But then potentially advising clients to maybe do 3 milliliters, like 3 times a day for a month, potentially with one mushroom. Would that be a good starting point?
Totally.
Okay.
Yeah.
The other thing that I really love personally, because I did a little bit of a deep dive in herbalism last year, is herbal mushroom blends and how fantastic mushrooms and herbs play together. Like, and so personally right now I'm doing nervous system training, so to speak, with holy basil and reishi in tandem on a daily basis, and seeing profound levels of what I feel to be cortisol regulation amidst challenges in my life, and so I think that that's where I really want to lean my own practice in, is like, how can we tend to certain aspects of your health and wellness through like the synergy of herbs and mushrooms for sure, but together, because why would you just focus on one, and I think that's where I also try to defer, is like, I'm not just like, hey, here's a bunch of mushrooms, get a subscription, get my subscription. It's like, no, what are you focusing on, and is it sleep, like sleep health? Let's introduce some valerian and a little chamomile and some passion flower with reishi. And that's where I'm finding the most profound effects from my own extracts in my life. So, yeah.
Yeah, that's great. I want to see way more mushroom herb combos that are thoughtfully made. And I think your original point too is so interesting. It's like, you would never just be given like a bag of herbs and be like, I'm taking my herbs.
Yeah. Like, what is in there? What would be in there?
What is in there?
Thousands, right?
Yeah. And I think that also speaks to like, I think about this a lot with like the, just using different parts of the fungal organism. And it's like, there's so much thought with herbs, right? It's like the root has such a different action than the flower or the leaf or even the berries. And so like all of that is taken into consideration. And, in some cases, like using the whole plant, like with like berberis species, like if you're going to use Oregon grapefruit, using the root and the leaves and the berries have a stronger impact on the digestive system than just using any one individually.
Sure. Or hawthorn.
And there's some other plants like that, but kind of, I think Oregon grape is kind of the one that comes to mind right now. And I think that could also, be a good example for lion's mane, where it's like, maybe we want to use the entire fungal organism there. Right. And that's not necessarily true for all mushrooms. But for some, that is the case.
I totally agree, and I think for me, and we're gonna dip our toes in the mycelium versus fruiting body, but lightly. I promise it's gonna be gentle. Because for me, growing up with my stomach issues, it was very, very apparent that when I removed grains, my health improved, and that's the big thing for me. It's not about, am I taking mycelium or am I taking mushroom? It's, am I putting grains in my body that aren't listed in the ingredient list? Because I'm not trying to eat grains in that way. Yeah. If I'm going for mushrooms, I don't. And I think that that's my biggest frustration as someone who is spending more money and time on fruiting body extracts and trying to advise my clients is, there are grain products out there that might harm your gut. They might influence more pro-inflammatory pathways if you have an autoimmune condition or any other condition, and that needs to be labeled. You typically on the ingredients list, it's like from mycelium, but it's like, okay, well, what grain is in there? That's very important. Even though it's fermented, because the mycelium has grown on that grain, it needs to be listed, in my opinion. So
I completely agree. And this is something I see in my practice all the time, where I'll have a patient come in who's taking mushrooms, or I'll recommend mushrooms, and they're like, "Oh, I don't respond well to mushrooms." I'm like, "Well, what have you taken in the past?"
Right.
And it's almost always a myceliated grain product. And there's a lot of kind of what's called like food protein cross reactivity with autoimmune disease, where it's like, for example, gluten, the amino acid sequence in gluten can look similar with other foods, can look similar like to casein or other grains, which would be why people who are sensitive to gluten end up being often sensitive to other grains, or those grains can also have a similar kind of like triggering effect, can cause an autoimmune flare. So yeah, I think that is a great point, and something I think about a lot is like, it is, it's really not about the mycelium. It's about the fact that there's like this filler that could be causing an issue.
Right, exactly. And I think for me too, as someone who has cultivated extensive amounts of mycelium in my life and grain spawn, it is very apparent which has more biomass. And it's like, if you look at a liquid culture versus a bag of rye berries that have been inoculated and colonized with grain spawn, you become immediately aware of the economics there, and that how much money is a driving factor in that. And it's not to shame any businesses out there. It's tough to have a business and to be a player. Yeah. But I think we need really good integrity with that. And I think more and more people within the mycology world, especially people like you, who I really appreciate, who have a diverse background in naturopathic medicine and research, laboratory research, can take a look at this and actually, with a little bit more of a critical eye, start to take it apart and look at, well, we could do better, And one of the things that would be fascinating is if we did have a pure mycelium product on the market that didn't have filler. Like I would take that all day.
Yeah, there is an adenosine one that I've seen. Somebody on Instagram pointed it out to me, from like bulk supplements.
Okay.
It actually looked fine. It's like, it seemed like it was a liquid culture of Hericium erinaceus that was standardized to a certain amount of adenosines.
I'm considering the scale of how big that liquid culture was to get to that product.
Right? I know, and I didn't see the cost of it. But yeah, it's like doing that on a large scale seems very hard.
Right. Absolutely. On an industrial level is, and I think too, like most of the original research with cordyceps before militaris became popularly cultivated, was done on liquid culture of what I think is like the C4 of Cordyceps sinensis. So a lot of the benefits there. Man. Thank you so much for this conversation. I'm enriched. I'm going to just let it soak into my DNA and then let it have that epigenetic effect and with that. Thank you so much for the time, and I'm really excited to share some of this with our community. I think that's all the questions that I have. I know that there are 10 to 100 other tangents that I would like to go down, but I want to be mindful of the time.
Yeah, let's do it again.
Okay.
This was very nourishing for me. I don't get to talk to another like mushroom nerd every day. So, most of the time I'm on podcasts, like people don't really know anything about mushrooms and the conversation is very different. And